Welcome. We are fortunate today to have Claire Cunningham, the Director of San Mateo County Human Services Agency, as our guest speaker. Claire was appointed as the Director in July 2023. Claire first joined the county in 2007 as a Deputy County Attorney after several years in private practice at a San Francisco litigation firm. She spent over a decade on HSA's in-house legal counsel and represented many other county departments and the local school districts during her tenure in the county attorney's office. The Human Services Agency is the second largest department in our county. Welcome, Claire.
Eileen, thank you so much for the kind introduction and for the opportunity to explain how H.R. 1, also known as the One Big Beautiful Bill Act, and related state actions affect our local safety net. Over the next 45 minutes, I'll summarize the key program impacts for San Mateo County, describe the operational and client impacts that the Human Services Agency is preparing for, and outline our next steps. Before I delve into these significant policy shifts, I want to provide some background information about the Human Services Agency, which is the cornerstone of San Mateo County's social safety net. We have 815 employees and an annual budget of $368 million, which we use to deliver a broad range of critical services and benefits that help combat poverty, strengthen communities, and keep children safe. The largest branch in the agency is called Economic Self-Sufficiency, and it administers the safety net programs that we're talking about today. CalFresh, Medi-Cal, and various temporary cash assistance programs, including CalWorks. But as you can see here, we have 7 other branches, and they all contribute towards our vision, which is a thriving San Mateo County community where everyone has the opportunity and support that they need to live safe, healthy, and prosperous lives. The Children and Family Services branch has about 200 employees and about 60 social workers, and they respond to and investigate allegations of child abuse and neglect. They also provide services to keep children safely at home and ensure appropriate placements with resource families when children must be removed for their safety. HSA's newest branch is called the Center on Homelessness, and that program and team serve as the nerve center of the county's efforts to ensure that homelessness is rare, brief, and non-recurring. They oversee the operation of our family and adult shelters, our outreach services to unsheltered people, homeless prevention, and housing support programs. And the last branch that I'll mention is our employment services team. They provide job search assistance, interview and skills preparation, subsidized employment opportunities, vocational training, case management, job placement, and adult education to different populations in order to help them reach self-sufficiency. So they serve county residents who have disabilities, people who are formerly incarcerated or experiencing homelessness, and residents who have other barriers to employment. And even with that quick overview of the agency, you can see how our different divisions weave together to form a safety net for county residents, often during their darkest hours. We have offices located throughout San Mateo County where residents can receive assistance in applying for and maintaining their benefits. The red dots on this map, one in South San Francisco and one in Foster City, are our offices that are either in construction or being remodeled. But the blue dots show our currently open and accessible regional office locations. We also have a call center, which is especially important during this time of heightened immigration-related concerns. And we have outposted staff who work at 2 different locations along the coast. The Human Services Agency is separate and distinct from the Health Department, which provides health services. Our role at HSA is to administer the safety net programs, not to provide the healthcare services to residents. We also partner very closely with the county's core service agencies, which are listed on the right side of this slide. The core service agencies are the best resource for people who need immediate help. So if you come across someone in your community who's struggling, please encourage them to get help at their nearest core service agency. They are also a resource for people who want to submit their benefits application online through the state's website called benefitscal.org. If anyone feels hesitant to come into a government building for any reason, they can get help in applying at a core service agency, and then those applications are routed to my staff for eligibility determinations and further processing. Let's dive into the recent changes. We have been very fortunate in San Mateo County to benefit from a long history of investment in services for our most vulnerable residents. However, and as we will be talking about for the rest of my time this afternoon, the state budget and HR 1 profoundly change how safety net benefits are structured, financed, and safeguarded, and they weaken the protections for those who rely on safety net programs most. And that's why it's critically important for all of us to understand how these changes impact county residents and the safety net that so many people rely on to make ends meet in such a high cost of living area, and also against the backdrop of increasing fuel, gas prices, and grocery prices. So many of the specific impacts of these policy changes are not yet fully known because the changes enacted by HR 1 are more sweeping than any undertaken since Medicaid's inception in 1965. And because of the staggered nature, which we'll talk about more a little bit later, of when the various provisions of HR 1 are scheduled to take effect, we are continuously assessing local impacts and operational needs. However, even with those caveats, it's clear that these policy changes will reduce the number of people who receive food assistance or health coverage through CalFresh and Medi-Cal. It will increase the number of people who are uninsured, decrease funding for our healthcare safety net, and disproportionately impact people with unsatisfactory immigration status. HSA is steadfast in its commitment to serving residents with compassion, integrity, and innovation. We understand the critical importance of protecting continuity of service for those who depend on our programs, demonstrating accountability by making fiscally sound decisions that honor the public trust, and remaining flexible as federal and state guidance evolves, while coordinating closely with county leadership and community partners. We are acutely aware of the many vulnerable county residents who rely on the safety net that we provide, and we are determined to meet this moment. So the two main programs that I'll be discussing this afternoon are CalFresh, which is food assistance. In federal lingo, that is the SNAP program, and Medi-Cal, which is health coverage, and that is Medicare in federal lingo. So residents who receive Medi-Cal and CalFresh rely on these benefits to access medical care and purchase food. And here in the Bay Area, where housing and everyday living expenses are among the highest in the nation, Medi-Cal and CalFresh benefits are critical to maintaining the health and stability of county residents. We have roughly 34,800 residents who receive CalFresh, and more than 1 in 5 county residents receive Medi-Cal. These programs are central to our local safety net. Now we'll delve into some of the program impacts of HR 1, starting with the expanded work requirements for CalFresh recipients. So in San Mateo County, an estimated 3,700 individuals will be subject to work requirements starting in just over a month on June 1st. So what this means is that adults aged 18 to 64 who don't have dependents must work volunteer, or participate in an approved education or job training program for at least 80 hours per month in order to remain eligible for their CalFresh benefits. And the adults who don't meet these work requirements will have their benefits limited to only 3 months within a 3-year period. And that's unless they qualify for an exemption. So there are certain exemptions to these work requirements. Some groups, such as those caring for dependent children or individuals with disabilities, may be exempt from these work requirements. And that really speaks to the importance of the work by my eligibility workforce, who really have to spend the time to talk to clients to understand whether they are eligible for an exemption to these work requirements, because that could make the difference for people in whether they receive food assistance or not. And to better understand the client impact of this change, it's helpful to consider an example. So this is just a generic example, very simple example. Jordan is a single parent who works part-time at a local restaurant, and he relies on CalFresh to cover groceries between paychecks. Under HR 1, he will be required to document 80 hours of work or approved training each month to keep his benefits, which he needs in order to help feed his daughter. However, with variable shifts and childcare responsibilities, meeting the strict verification windows can be difficult. And if Jordan misses a deadline because a pay stub is delayed or misplaced, he could lose his benefits, forcing him to reallocate spending from other household necessities, excuse me, like rent, transportation, and utilities. So as you can imagine, the loss of food assistance can quickly destabilize a household and increase demand for emergency services provided by our partners at the core service agencies or at other nonprofits and charities. And if Jordan isn't able to attend a food distribution event, maybe due to his work schedule or childcare responsibilities, he and his daughter might go hungry or be late on rent, putting their housing in jeopardy. From the staff perspective, Jordan's case really shows that how much additional support he'll need. His case becomes much more time intensive under HR 1. Multiple phone calls, verification requests, and possibly even an appeal. Another change to the CalFresh program is that beginning on October 1st, HR 1 reduces the federal share of CalFresh administrative funding from 50% down to 25%. So this isn't the money that goes towards benefits. This is the funding that goes towards the workforce that administers all of these very challenging program rules. And with state and federal decisions still evolving, we are engaging with our partners to clarify how administrative funding will be allocated and what the county share will be. But right now, we're estimating that the county will lose $2.6 million in CalFresh administrative funding. That's contingent upon final allocation decisions. So to put it differently, HR 1 cuts HSA's CalFresh administrative funding by about $2.6 million, while dramatically increasing the administrative workload. So switching gears from CalFresh over to Medi-Cal, there are 3 headline numbers that drive our planning. We are anticipating that 27,000 individuals will be affected by the reinstated asset limit test. I'll explain what that is in a little bit. 61,000 individuals will be subject to new work requirements, which are similar but not the same as the work requirements for the CalFresh program. And of the 93,000 annual renewals, we anticipate that 56% of them will switch and have to do twice yearly renewal process. So let's pause here to consider another example of the client impact. Rosa is a senior who receives Medi-Cal and a small CalFresh allotment. The reinstated asset limit requires reporting property and other resources and assets that were previously excluded from eligibility determinations. So for Rosa, gathering deeds, bank statements, and similar paperwork is confusing and often requires help from family or a caseworker. And moving renewals from once a year to twice a year increases the number of renewal packets and documentation requests that Rosa must respond to in order to keep her benefits. A missed renewal could delay medications or home visits. And if Rosa doesn't re-enroll in time, she will lose her Medi-Cal coverage, which may lead to her no longer being able to afford medications or stay on top of her health needs. Medical costs incurred during a loss of coverage could lead to bankruptcy and homelessness. Older adults are the fastest growing demographic in our homelessness system, and the changes imposed by HR 1 will exacerbate that distressing trend. And for my workforce, Rosa's case requires patient, hands-on assistance and coordination with legal or benefits counseling resources, which takes time away from other cases. And I'll just pause here. I don't know if any of you watched The Pit. I've been really intrigued by that show, and they've had a couple of interesting episodes that show the impact of these cuts. On one example, and this isn't a spoiler, but a mom and her son with asthma who had to cut back on medication due to the changes, and then also a patient with diabetes and the impact that this has had. Just really powerful television. Okay, enough about television shows. These changes will have a disproportionate impact on residents with unsatisfactory immigration status, which refers to individuals who don't have a recognized immigration status that qualifies them for federally funded full coverage Medi-Cal. So this includes undocumented adults, asylum applicants with work authorization, DACA recipients, some green card holders, and others who hold certain types of visas. And starting January 1st of this year, these individuals no longer are eligible to enroll in full scope Medi-Cal, even if they previously qualified. But they can still qualify for restricted scope or emergency coverage. And for CalFresh on April 1st, certain lawfully present non-citizen categories, including asylees, refugees, parolees, and similar classifications, are no longer eligible for CalFresh. And in San Mateo County, we estimate that 1,000 CalFresh recipients were affected by this change, meaning they lost their CalFresh benefits. In addition to the human impact of these immigration-related changes, which dramatically impact groups that are already extremely vulnerable, the policy changes increase administrative work at intake and redetermination, drive higher call and in-person volumes, and likely generate more appeals and requests for information as affected individuals seek clarity or reapply. They will also increase the demand on county health system resources for uncompensated care when Medi-Cal coverage is lost. So over the next few years, we are projecting that about 21 to 31% of the county residents who are currently on Medi-Cal will lose their Medi-Cal coverage as a result of these changes. And as resources are reduced over the next several years, the impacts will be felt by everyone. Not just Medi-Cal recipients, as that will drive up greater demand on our emergency departments as people can no longer access preventative care. And it will also increase health risks because people, which was also shown in the episodes of The Pit that I mentioned, through delayed care. At the community level, the changes will lead to worsening health outcomes, which again affects everybody, not just Medi-Cal recipients, increased disparities, and higher long-term costs. So, from the worker's perspective, each new verification requirement adds steps, whether that is phone outreach, document review, follow-up, and sometimes preparing for a fair hearing. Our benefits analysts are focused on accuracy to avoid error rate penalties, but that accuracy requires time and training. The cumulative effect is longer processing times and higher staff stress. These changes also impact staff morale because they must now work harder to provide less benefits to fewer people. That doesn't sit well with a workforce that's committed to making a difference in our community. And when a caseworker succeeds in preventing a coverage loss, it is a meaningful outcome, but it often comes at the cost of extra hours and diverted resources. So these impacts show why our planning must account for both fiscal exposure and the human cost of administrative complexity. We're also anticipating longer wait times for people who come in person to our offices for service and reach out to our call center. We've implemented a callback feature at our call center so that people don't have to sit and wait on hold. They'll get a call back when they're next up in the queue, but it will still obviously negatively impact our clients, and we know that. And then this last bullet point here about coordination across programs. We are working very closely within our agency and our employment services branch of the agency to ensure that the benefits recipients who are newly subject to work requirements will be able to satisfy those work requirements through referrals to our employment service agency. But that is a dramatic scaling up of our work and capacity in that branch of the agency as well. So this slide shows a timeline, and the implementation of HR 1 is staggered. As I mentioned earlier, that was done by design due to the midterm election date. And this slide shows some of the key dates of anticipated impacts on our safety net. We're already implementing the new asset limit test for Medi-Cal, and adults with unsatisfactory immigration status are no longer eligible for full scope Medi-Cal. On June 1st, we'll begin implementing the work requirements for CalFresh recipients aged 18 through 64, which could result in almost 4,000 county residents losing their food assistance. And on July 1st, adults with unsatisfactory immigration status will lose their dental coverage, except in emergencies. And then you can see some of the other changes that are on the horizon in 2027 and in 2028. So our next steps are clear. We will stay aligned with our state partners as our guidance evolves. We're updating our cost estimates as implementation details emerge, monitoring client and operational impacts very closely, and strengthening our partnerships with our community-based organizations through data sharing and coordinated communications. And in closing, HR 1 represents the most significant federal change to the safety net in decades. The operational and programmatic impacts are substantial and will grow if the state does not backfill lost federal revenue. Been spending a lot of time up in Sacramento and working with our legislature to advocate for enhanced funding to help offset some of the federal cuts to the work that we do. And HSA remains committed to protecting continuity of service, minimizing harm to residents, and managing fiscal risk through prudent planning and strong partnerships. And even though our external landscape is growing much more complex, we are supported by a very strong foundation. We have an incredibly dedicated workforce. We have trusted community partnerships and a lot of support from the county leadership. So with that, I'm happy to stop sharing and answer any questions that we may have. So I see a question from Linda. A dollar value on the lost revenue, both benefits and administrative support. So we are still figuring that out. A lot of these details are still being worked out. And of course, it depends on what happens with the state budget, which is why we're spending a lot of time and energy in advocating at the state level. One of the other roles or hats that I wear is with the California Welfare Directors Association, which is the statewide association that covers all counties and all of the HSAs across the state of California. And this year, I'm the vice president of the organization, which enables me to meet every month with the leadership over at CDSS, the California Department of Social Services, and DHCS, the Department of Health Care Services, and really share information and explain to them how these policy changes are impacting our frontline work and what we're observing and the help and support that we need at the state level. And so we are hopeful, remain hopeful that the forthcoming budget will include enhanced funding for the workforce because as you heard, these changes are going to have significant impacts on clients and on the county eligibility workforce. So in terms of dollar values, we have been submitting requests with statewide dollar amounts. In San Mateo County for CalFresh, we have projected that our lost funding will be $2.6 million and will likely grow in out years. We don't yet have enough information to determine the shortfall in the Medi-Cal work that we do. But we are continuing as the guidance comes out to put those estimates together. And right now, we are currently fully staffed for the prior workload level. And so that's what's been really challenging is that these changes dramatically increase the paperwork, kind of the red tape that nobody seems to like about government. Well, we've got a lot more red tape now as a result of these policy changes, which means a lot more work and a lot more touch points by my staff. And so we are fully staffed for the prior workload, but not only were we not given additional funding to address the increased workload, we are experiencing cuts in future years. So that will impact our abilities to meet the needs of our county residents. Yes, we will absolutely share a copy of the slides. Let's see, what are California and nonprofits doing to minimize the impact of lost financing for CalFresh and Medi-Cal? Well, something that I have been trying to support is we really need philanthropy to show up right now and help bridge the gap that is coming as a result of dramatically decreased federal funding. And then we're also advocating at the state level for state funding to help fill that gap. But it's just so it's you know, when you include the impacts on the health system, it's about $6 billion with a B. So it's a lot of money that that is needed, and that just goes to how important the federal funding is in supporting these programs, which are really the state versions of federal programs: the SNAP for food assistance, Medicaid, and TANF, temporary assistance for needy families, which is called CalWorks in California. So given the shift in priorities and at the federal level, these huge amounts of costs are being passed down to the state government, and we'll see how much the state decides it can absorb, and then the rest will be left to local governments to try to fill that gap. And it's really going to fall on philanthropy and others to step up and help meet the moment. So something that we're doing is trying to share a lot of information. So at HSA, we've created a data dashboard that we've shared with our partners and with philanthropy so that they can track the number of people who lose their benefits over time. And I think that's going to be really important to see. We can project and anticipate which communities will be the hardest hit, but it will also be helpful to see on a month-by-month basis what the numbers tell us in terms of who loses their eligibility for the benefits that they rely on, where they're located, and which subgroups are most deeply impacted by these changes. So let's see, question from Catherine. Does CalFresh eligibility affect ability to access other partners, such as Second Harvest? I don't think it does. Most of the food distributions that exist. They don't check to see if you're receiving CalFresh, or even if you are, you're not restricted from participating, because CalFresh, even when it's fully funded and sort of the prior version of CalFresh, was only ever meant to be supplemental nutrition assistance. So the amounts that families and individuals receive on the CalFresh program were never intended to fully pay for the food needs, and they certainly don't come anywhere near addressing the food and nutrition needs with the high costs that we're experiencing right now at the grocery stores. So it doesn't necessarily, if their eligibility, impact their ability to access other partners. And it also shows how important it is to support our partners like Second Harvest and our core service agencies that also partner with Second Harvest to distribute food out in the community, because there are so many people, particularly now, we're seeing a big increase in new individuals and families who have never before had to utilize safety net services because of the high prices at the gas pump and everywhere else. And the tightening economic market, it's getting harder to find jobs and keep jobs. And that's impacting more and more people, even in a wealthy county like San Mateo. Question from Barry. Hi, Barry. At Job Train, we are working on developing a plan to assist recipients who need help. Can you discuss what the work requirements will look like and how other organizations like Job Train can help? Yes. So basically, recipients right now for CalFresh, and then starting on January 1st of 2027 for Medi-Cal recipients, they are going to have to come in with paperwork and be able to document and establish that they have worked the 80 hours per month in an approved job training, volunteer, or education program. And so right now at the state level, we're working to try to automate some of those checks so that we can ping different databases and different systems. But, until that gets set up, clients are going to have to bring in things like pay stubs or bring in other paperwork to be able to establish that they have met the employment requirements. And so, as you can imagine, when you have an economy where it's getting harder and harder to find jobs, and also you're talking about people who have barriers to employment, that can be a very difficult task to be able to satisfy work requirements, which, as I mentioned earlier, really speaks to the importance of the eligibility workforce having the time and wherewithal to talk with clients and build rapport to talk about what can be sensitive topics like disabilities or health conditions or things of that nature to determine if they're eligible for an exemption to the work requirements. It becomes very high stakes to make sure that every eligible individual gets their exemption so that they don't have to come up with the paperwork or otherwise try to satisfy the work requirements, which if they don't, they're going to lose their coverage. So Barry, really grateful for your partnership and that of Job Train, but groups or organizations like yours and others will be helping by providing employment and providing the paperwork. So I've also met with Sam Sita and helped spread the word to our business community. We're also setting up some job programs within the county so that people can get connected to good paying employment with county employment. But we're expanding our programs because you saw the numbers of how many people will now have to satisfy these work requirements. That means they're going to need to find jobs. So what role can the League of Women Voters play in mitigating some of these impacts? Well, something that's really important is helping us to get the word out. So the messaging that we're trying to get out to our client population is pretty simple, but very important. And that is to make sure that their addresses are up to date in the state system, because the renewal packets are sent out by mail. And so if people have an old address in the state's database, their renewal packet will get sent to the wrong address. And that could mean that they don't receive it, or don't receive it in time in order to fill it out and submit it to keep their benefits up to date. So similarly, we're trying to get the word out, besides having your contact information up to date, that it's really important to read your mail right now and don't lose that paperwork. And if you need help in filling it out, come to one of our offices, make an appointment with a benefits analyst so that that the paperwork doesn't fall by the wayside. The timelines have tightened up significantly. There's less time now to catch people who inadvertently fall off the programs and get them reinstated. And so it becomes that much more important for people to correctly fill out the paperwork on time and do it right the first time. And then also getting the word out about where people can go for help. As I mentioned earlier, we're seeing a lot of new families and individuals that are being pushed into the safety net because of the broader economic impacts that we're all experiencing. And so these are people who don't know what our safety net is in San Mateo County. And so I'm really grateful to have this opportunity to come and speak with you all. And if I can sort of deputize you all as ambassadors or something on behalf of HSA in terms of getting the word out so that people understand what these changes are and what they need to do and how they can help. And so what really helps for the Human Services Agency is if anybody is able to either donate or volunteer, is to support our core service agencies. They really are the front line of support, and they're the ones that our most vulnerable county residents go to for their immediate safety net needs. And so we want to get the word out to people that if they suddenly find themselves in a situation where they may lose their housing because the bills have just become overwhelming, or they're struggling to put food on the table, or any other type of need, to go to their core service agency. And there are a lot of people out there who don't know what the core service agencies are or how to access them. And so by you helping to spread the word, that will help people not miss out on an opportunity to get rental assistance, to get other financial or other support that they may need in order to prevent themselves from falling over into the safety net. And that's really important too from a systems perspective. I mean, on the one hand, you can all imagine the human impact that this has on families that are struggling to make ends meet in San Mateo County, where everything is so expensive. But if you set all of that aside and think about the cost to the overall system, it is far more expensive to serve an individual or family once they've lost their housing and need shelter or other types of services. It is much more cost effective to provide rental assistance or other supports in order to keep people in their homes that they already have. So that's why it's so important too to get the word out so people know where they can go to get help before it's too late. And even if they lose their housing, you know, that's also where the Human Services Agency comes in with referrals and to our shelter system that we have and other programs. Okay. Lots of great questions coming in. This is great. The data dashboard available to the general public. You know, right now it's just being shared with partners. In the future, as this goes on, we may open it up to the public. But you know, for now we're using it to help drive operational planning and strategy development. So where do benefit recipients go to show their proof of work requirements? How challenging will it be for recipients to be seen in a timely fashion? So that is part of the process to apply for and maintain their benefits through My Workforce. So if they want to come in person, they can make an appointment at one of our regional offices that I showed on one of the earlier slides. And they can sit down and talk with somebody, and they will get guidance on exactly what pieces of paper they need to bring in. And they can also submit it online. There is an online portal called Benefits Cal, and that is a way for people to apply for and renew their benefits through the Benefits Cal portal. But some people have barriers, whether it's technology barriers or language barriers or literacy barriers, whatever it might be. And so those online portals don't necessarily help everybody get the help that they need. And that's why we have our offices that are open 5 days a week and throughout the workday. So, how challenging will it be for recipients to be seen in a timely fashion? You know, that is the big question. And it's just really frustrating, if you'll allow me to vent for a moment. It's really frustrating because one of the things that I focused on very intensively when I became the director of the Human Services Agency was lowering wait times. We know that our client population, many of them are juggling multiple jobs, juggling the demands of young kids, et cetera. They lead very busy lives, and having to sit and spend several hours in a lobby waiting to be seen by an eligibility worker is a real hardship. And so we did really great work in reducing our wait times, but as I mentioned, we are now in a different reality where the work is significantly more complex and more time intensive, and we have less funding in order to do all of that work. And so, you know, just to be honest with everyone, I'm anticipating that over the course of the timeline, as more and more program changes are implemented, the great strides that we made and have made in reducing wait times will shift, and it will take longer. But just know that that is a top issue and a top priority, and we will do everything in our power to keep the wait times as low as possible. So, how is the word getting out on the coast about the HR1 changes? Our great partners out on the coast, the core service agencies out there, are helping us to spread the word. And we've also been working with a lot of different partners in a newly formed health coalition to get the word out through people's healthcare providers. And we're also developing videos and different flyers. It's hard to, this has been a bit challenging from a communication standpoint because the changes are quite complex. And so trying to distill it down into a simple flyer has been a challenge. But we've been busy working on different tools and different assets to share to help get the word out. And we are still building out our listservs and our resources for sharing those resources. But we've been working with lots of different partners from the faith community, from the nonprofit community, philanthropy, government, local government, all sorts of different groups to try to get the word out. And we are still iterating. So would love to receive any suggestions or recommendations about groups we might be missing and how we can do better at making sure people understand what's coming and how to prepare. So if you have any thoughts or advice, please feel free to put that into the chat. Are undocumented children going to lose benefits? So undocumented children will still be able to receive Medi-Cal coverage, so they will still have their health coverage, but they could lose their food assistance. So, and also there are even being new changes that are being proposed now that are designed to eliminate benefits going to households that even include just one undocumented member, whereas before the benefits were prorated so that the household could still receive benefits, even if but based on the number of documented individuals in the household. So that's evolving and not in a good way. The core agencies, those are the different agencies that were listed on an earlier slide that you'll see that the Human Services Agency contracts with. And we have them, the county broken out into different service areas. So there is one core service area for each region of the county. And so everybody can find out what their core service agency is for their city or their area. And that's really the best place to refer folks who are finding themselves struggling with the risk of homelessness or food insecurity. So what would those volunteer positions look like in terms of skills required? You know, maybe somebody on the call from a nonprofit can provide a better answer, but you know, I volunteered at food distribution events and it didn't require really any skills other than helping to stack the milk and hand it out to people who were coming through the line. So you know, the volunteer roles are really they can find something for anybody in how to support. But I wouldn't worry about the skills required because they will find a way to put you to work. Comment, oh, yes, thank you. It's maddening to see the increased administrative burden with reduced funding. Yes, it is. Thank you. Do the estimates assume that you will be able to scale services to the new demand? No, they don't. There isn't any attempt to justify the reduced allocations other than the federal government has determined that this is no longer a priority. And so that's why they are reducing funding. So, you know, another thing to think about is that the One Big Beautiful Bill Act is not a program reform bill, and which is part of why it's caused so much consternation among in my world. Because it's not like, despite what you may have heard in the media, it wasn't designed to address identified and specific issues, you know, waste, fraud, and abuse, or whatever. It's a tax bill. And it was really designed to reduce taxes on the uber wealthy. And so that's the way it's written. And so that's part of what's made it incredibly challenging for us to understand and implement, is it just wasn't even designed from the get-go as a means of reforming the programs. It's just cutting funding in order to reallocate those dollars to tax cuts. So then it becomes very high stakes and challenging for us to interpret a bill, you know, federal law, HR 1, that was never designed to tell us how to reform or revise our programs that we offer. It just imposed a lot of requirements that don't align with how we do our business, and really raised more questions than answering. It didn't really answer any questions. So that's challenging. How many more might be impacted if my agency is not able to scale our work? Well, the slides included the outer limits of the number of folks that will be impacted. And so that gives you a sense of the maximum exposure by these changes. And of course, we're anticipating that through our outreach and through our work and the work of our partners and getting the word out, that not all of those people will lose their benefits. They'll be able to meet the new requirements. They'll be able to turn in their paperwork twice a year instead of once a year. All of these new red tape hurdles and burdens, it's our job to make sure that as many people as possible are able to satisfy those new requirements and keep their benefits. It's just important for all of you to know that to do that is a lot harder now for our clients and for our staff. So if HSA isn't able to, if, for example, all of our advocacy work at the state level is unsuccessful and the state budget that is adopted in June of this year does not include increased administrative funding, then, we're still going to roll up our sleeves and eat our Wheaties every morning and do everything in our power to meet the tidal wave of demand. But it will likely mean longer wait times. So it'll just be that much harder for people to navigate these complex new rules and new requirements. So we're hoping that the legislature understands how important this is and allocates more funding for our workforce so that we can hire new workers. Let's see, a question from Linda. Do we have plans funding for a multi-language ad blitz to tell the broader? We are working on it right now. Keeping their address current. Yes, wrap buses and bus stop surfaces. Well, I don't think we have that much money, but we are working on all sorts of assets. And that's been another challenge is that, ideally the state would have provided all of this so that each county didn't have to create it on its own. But because the federal government has been delayed in releasing the guidance, we're still waiting for some of the guidance that tells us how these changes are going to work. And so we can't communicate it out until we get the rules straight from the federal government and then explained to us through the state government. It all kind of rolls downhill to the local government. And so we are working on flyers that we're going to be distributing. We just finished filming a video. We're working on different videos because we know some of our clients have language and literacy and technology barriers. And we're translating everything into like 4 or 5 different languages to be able to get it out. But we've had to do that on our own with just our agency resources. And we have one person in our department of 815 employees. And he just started in September. I was so glad when he was hired. But we didn't have any communication support before then. So this has been a pretty big lift, and we're really busy trying to get it out there. Oh, thank you, Amanda, for putting the link to the core service agencies into the chat. And let's see. Medi-Cal reductions affect reproductive care availability. Pregnant people will still be able to access health services. There's an emergency exemption and also a pregnancy exemption. So whereas before, undocumented individuals were able to apply for and establish eligibility for Medi-Cal. As of January 1st, they can't, but they can still receive emergency care and pregnancy-related care. But that's kind of a nuanced message too, right? People have to understand that distinction and know that they can, when all the messaging is, you're losing your benefits, or they'll receive written communication, probably from my agency, explaining you are not eligible to receive Medi-Cal. They'll have to understand that nevertheless means that they can receive emergency services or pregnancy-related services. Let's see. Oh, advertising in the San Mateo Daily Journal. We are not yet, but is that a good place to get the word out? I'm seeing some thumbs up. Yep, I read it every day, so appreciate the work that they do. Any other questions? Maybe somebody didn't want to write their question into the chat. Oops, am I at time? Or do we have a couple? Okay, so I don't have to cut you off, but
you're doing fine. Great, thank you.
Any other
Nope.
questions or even, from some of the partners on the call um, that have their perspective that they'd like to share, maybe what they're seeing?
No, no other questions? Then we'll go ahead and wrap it up. Tina has a few, wait, same as CNG. Tina has a few additional slides and some information to share with everyone.
Yep. Just
Thank you so much, Claire. That was so informative.
Oh, my pleasure. I always apologize that it's a doom and gloom presentation whenever I'm around. But I really appreciate that all of you have taken the time out of your day to hear about this, because it's, like I said, it's going to have a huge impact on our vulnerable communities, and it will also impact everybody in terms of access to the emergency room, in terms of spread of illness and disease from lack of preventative medicine availability, all sorts of things. So thank you very much for giving me this opportunity. Really appreciate it.
Right. And as we mentioned, Claire will be sending us some of her handouts, and we will attach those to the email we send out with the recording and post links to them on our website. Thank you so much.
Okay, well, that was quite a quite a lot to cover. The one big beautiful bill, it may be debatable, but one thing's for sure, it is big. And we've got a group of people that are working to provide some additional information and context around the bill. So the idea is to help voters understand what it really involves, starting with the national picture and then connecting those changes to California and San Mateo. We're hoping to do this through kind of a visual driven format and using multiple formats. Um, what Claire has given us is a great introduction to aspects of the bill, especially kind of in San Mateo, what's happening with Medicare or Medi-Cal and CalFresh. But it goes beyond that. And the story really doesn't get better when you look at some of the other aspects of the bill, but we are doing some work to help voters understand what that is. If you're interested in learning more about it or joining that work, let me know. And we have plenty of work for you to do, so feel free to join our merry band. Um, the next thing I wanted to let you know about is this is something very exciting and very positive in a time that I think our democracy is facing lots of challenges. We have an opportunity in San Mateo to change how the county supervisor districts or district maps are drawn, and to change that from the current system, which relies on approval from the Board of Supervisors, to using an independent redistricting commission. The League has supported independent redistricting commissions for a long time. It's in our national and state policy positions, so you can look those up online. But what I would like you to do is to encourage you to go either to the South County or the North&Central League websites to learn more. If you follow this QR code, you'll find more information about what this is, but very importantly, information on how you can write to your supervisor to encourage them to support this measure. It will be discussed at the May 5th Board of Supervisors meeting, and if we're successful, you'll see it on the ballot in this fall. So please take a moment and look at that. I think it takes less than 5 minutes to send a message to your supervisor and encourage them to support the measure. And so we're trying to build support for this. And then we need there's lots of things happening in both leagues. So this is just one of the things we're doing. but in particular, we're looking for volunteers to help with the many, many things we do to support voters through the election cycle. So you can find out more if you go to either of our websites. There's plenty to do, and we can adjust to what your skills are. So much like if you want to volunteer at one of the community centers that the HSA group is working with, we can adapt to your skills and your interests. There's something for you to do in the league. And then just lastly, if you're not a member of the league, but you've enjoyed this program or other programs that we do, here are links to join and become a member. And we have members with all different walks of lives, all different activities, all different levels of engagement with us, and we love them all. So please come join us. And with that, I will just thank everybody for coming. This has been such an interesting and engaged group. I appreciate everybody's attention and the time you've given to this issue. And I wish you a lovely afternoon. And with that, this meeting is adjourned. Thank you so much.